My name's Alice Roberts, and I'm an Episcopal priest. I'm the rector of Epiphany Church here in Newport. I'm really hoping to let other people know that there's not just a terrible problem with addiction, but it causes circles of pain to go out from to other members of the community. My daughter Susan was 38 when she died. She met people, she went to college, she's a college graduate, and she started smoking. That wasn't good. When she graduated from college, she became involved with friends who had a good time. They lived in Florida for a while, and she became an alcoholic. I wasn't aware of it particularly, but as time went on, it was pretty obvious that she had a drinking issue. My daughter didn't help me become aware of it, and I didn't find out about her alcoholism until we were together for a week together. I think that colleges are very dangerous places for that now. I'm sure my daughter used cocaine in college. I was talking to some of her college friends, and that's what they did.
Yeah.
But she preferred alcohol, I think, at the time. I'm not convinced about that because I just was completely unaware of all of this stuff. Because there's the other whole part of it, which is kind of the human trafficking part of it. But once you get started into the drug scene, then you can be coerced into doing all kinds of behaviors that you would never dream of doing. Her drinking got worse and worse. She was aware of being an alcoholic, and she had been going to AA. She went to Millie's Place. She went to AA meetings around here. She knew the people here, and she was working on it. But somebody introduced her to the next level, and but she was brilliant. She was beautiful and brilliant. She had the most beautiful blue eyes I've ever seen, and she had beautiful skin, and she was just very, very lovely and beautiful. And she was very smart. She graduated with honors, National Honor Society. And after she fooled around in Florida for 3 years or so, she came back to Cambridge with a friend, and she got a job at Harvard University where she worked for 10 years. She worked in the Harvard University Health Services. She was the pharmacy buyer for the pharmaceuticals for that, and she was just doing a great job. She was sick a lot, though. She got pneumonia every fall, and one year in February, she got pneumonia so badly, and partly because she refused to go to the emergency room, but she got pneumonia so badly that she was in intensive care that she almost died. And she had to have surgery on her lungs. This was about 3 years ago. She had surgery on her lungs to empty out all the phlegm and stuff that had collected in her lungs, and she was in the hospital about 3 weeks. And in the course of her coming out of that problem and recovery, when she left the hospital, she was given a list of pain medications that would probably kill most people. She's already taking asthma medications and lung medications and anxiety medications, and now she had a whole list of other things to contend with. And among them, of course, were opiate pain medications because her surgery left her in pain. And since that time, about 3 years ago, I didn't realize it, but looking back, I'm sure that she drifted from her alcoholism into pill use. And then eventually, because she was still unable to work, Harvard University gave her a huge, they gave her a 2-year extension of her pay, and she was able to, she couldn't get her job back because she couldn't work, but they helped her a lot financially. And that, of course, was bad in some ways because she turned from medication to street drugs. I'm sure I'd look back on it and I know that's what happened. And so in the end, maybe for the past 6 or 8 months, I'm pretty sure she was a heroin addict. I didn't know it until the day she died, when the coroner called me and told me she had died, and I said, well, oh, she probably just didn't get to the hospital in time with her lung disease. And he said, no, it's probably a heroin overdose. And I was shocked with her death and shocked with the heroin. After her time in the hospital and her surgery, if I had been able to see that this was a downhill spiral, and if I could have found a place for her to go, there are wonderful places in the state. There's Plymouth House, which is for recovery, and there's other recovery places, but they're expensive. You know, if I had gotten her into a month or 2 month long recovery situation, that might have helped. She did go for a 1 week recovery that Harvard University paid for. And I didn't know why she was doing it exactly, but it clearly was because she knew she was taking too many pills. That was after her surgery. Well, I'd tell her I love her, for sure, and tell her, I think you know, in hospice we have the 4 things that you're supposed to say at the end of someone's life, and one of them is, forgive me. I forgive you. I love you. And those things are what I would say, I guess. Please forgive me. I forgive you. But I'd want to help her get healthy, that's for sure. I have pictures of her when she was younger. I think when she got away to college, you know, that's when drinking and carousing all began. But I have pictures before that, and before she really went downhill, I guess. Took a long time, but and those pictures are so beautiful and so healthy and lovely. You know, if your child is hurt, say they're a football star and they hurt their knee, but they need to be out there on the field next week, and the doctor gives them, here, you take this pain medication, and next week you'll be fine. I mean, you'll be pain free, and you'll be able to play. But soon, you know, it's a downhill, slippery slope, because the pharmaceutical industries say, well, if there's enough pain, it doesn't get addictive. But the fact is that it's addictive when you start taking it. I wish no other parent would have to go through this. It's too horrible. But, you know, I see all these terrible things happening in the world, and now I see everybody as somebody's child. Everybody has a mother, and every mother just grieves terribly. I know I have to tell my story. That's how it is. So I started talking about it. I'm not an addict. I don't know anything about addiction. I don't know the terrible pull of addiction. Although I'm sure if I took opiate pain medications for a while, I probably would have that yearning, but I just don't understand it that well. But I'm sure a group of parents of people who have died of drug overdoses would be a really helpful thing for me. This Hope for New Hampshire has formed a group here in part of my church, in the rectory. They've rented some space, and I am very, very, very happy to have them with me here. I haven't gone to any of the groups yet at all, except I went to one of the movies. I went to a movie that they showed, and it was very instructive to me. I do want to become more part of that effort, and they're asking me to do some of the spirituality and the bereavement that goes along with this. And I'm happy to do that. I can't do it right now for many reasons, but I will be hopefully taking more part in that kind of thing. Because is the whole spirituality component is really important to recovery. And also because of my own bereavement, but also I know a lot about bereavement because I have served as a hospice chaplain for 20 years. I just think that we just need to have much more awareness. I'm glad for Hope for New Hampshire is in the area. I just think the more work we can do on accepting the fact that we're all in this together somehow or other, that we can't judge people for their habits, and we have to take some of the blame ourselves, and we are complicit in this. We're part of this. There's ways that we maybe have shamed people who are addicts, and then made them feel so bad that they can't go and get the help that they need. So there's an attitude adjustment we need to make. Whether we do it or not, I'm not so convinced, but there, pretty soon there's nobody in this whole community is not going to be affected by addiction. And I certainly am here as an example. I just had no, I can't say I haven't been affected. I've known lots and lots of addicts. I don't have a problem getting to know addicts. I'm not judgmental particularly, but the fact that my own daughter died of an addiction just makes me, it plunges me into the middle of this recovery. We need to think up ways that we can hit people over the head. I feel like I was hit over the head, and but if we can somehow start a conversation in which the shame doesn't take a high point, that if we can reach out to people and try to help them and have confidence that they're going to be helped, instead of giving them more ways to be an addict. No, we need jobs, we need support groups, we need hospital space, we need places people can go through detox if they need to. We just don't have any of the care. People in recovery have so much to offer because they have so much more. They have a whole component of their lives, the struggle that they've been through and the places they've been and the awful things they've seen and the shame they've been through about themselves. Once you're in recovery, you're a new person. You're just wholly made over. And then you feel that you've been saved. There was one phrase I heard when I was working in the prison, I heard all the time, which was, I know God loves me because, and then I could just finish the sentence, because God put me in jail, in prison, and if God hadn't done that, I'd be dead. We have to be compassionate about a certain type of person that we've always not been compassionate with. There's a saying that goes way back thousands of years. Be kind to everyone you meet, because everyone is carrying a heavy burden. We need to remember that this society is burdened in a way that other previous years have never seen this, and we don't really know what to do about it. So basically we try to turn our backs on it and ignore it or shame it, but we need to all jump in and help with this, and help our relatives and our friends. Get the drugs off the street, of course, that's one thing, but then people are going to go, people who want drugs are going to find them. So that's not it entirely, but don't get people started on drugs. Be very careful of opiate pain medications. I think that's a huge problem that hasn't really been recognized, that there's some complicity in this with big pharma and for doctors who think that they can just give this stuff out and it won't make any difference. So we have to be really, really careful about that. We're aware so that nobody gets started on an addiction that they can't control. And even, I mean, people my age are given Percocet and Vicodin and things that just when they feel a twinge somewhere. So that has to stop. Because there's people my age that are addicted, not because they have any desire to be addicted, but because they've gotten started on pain medication. My message to the community is the same one that I give to people who are searching for a spiritual relief in some way, or a spiritual path, and that is show up, pay attention, tell the truth, and don't get invested in the results. This piece of information will help you no matter what in your life, and in particular when we're trying to clean up this whole drug mess. The more we can talk about it and be part of the solution, then we're not part of the problem. Hopefully other parents maybe we'll all get together, those of us who have had this happen to us, and help each other. I'd like to make the world a better place. She was wonderful. Miss her. I just miss her terribly. But she loved me, I know she did. She didn't do it because she was a mess and needed to have, to hide from her life. She was an addict. She was a human being that was an addict. It's a disease. 3 days before she died, she was playing with a card, like a deck of cards that she had that you pull out a card and it was your spiritual guidance for the day. And she pulled out a card and she sent me a picture and it said, "My spiritual coaching card for today is metamorphosis, like the caterpillar that emerges from its cocoon. You are about to get your wings. We are made of stardust." It was about changing. So she saw that as a wonderful thing, and she texted me a picture of the card and everything. And then the day she died, the very day she died, she pulled another card and sent it to me, and it said, "Speak up, your soul is guiding you to stand in your light and speak your truth. Love you." So I take that. The speak up part is for me. I need to speak up.